I'm a member of the Community Advisory Board for the Holden Comprehensive Cancer Center at the U of I. Yeah, I was a cancer survivor, so I was tested in a routine blood test for a PSA test and got my PSA test on my right about my 49th birthday, and found out I had a high PSA, and almost immediately after that found out I had prostate cancer. So after diagnosis, basically that's the Band-Aid getting ripped off. I found out I was going to go through quite a bit of surgery and treatment, and took as an aggressive approach as I could, and everything was successful. So I was very fortunate.
Yeah, can you talk about the timeline from that diagnosis and then I assume later getting involved in the cancer board?
Right. So yeah, so let's see, be 3 years ago, 2022, got my diagnosis. Immediately after that, had a surgery, followed by radiation and some other therapies. And once I reached the point where I knew everything was going to be okay and I was going to beat cancer, I wanted to get back in any way I could, right? Give back with volunteering. So I found a few other outreach groups, and just nothing was really a good fit schedule-wise. So I started talking to members of the Community Advisory Board, specifically Natasha Askelson and a couple of others. And one of the things that they talked about was they found out about my desire to be an advocate with a company newsletter that I put out. One of the ladies was a customer of mine, and I put a company newsletter out, and in my company newsletter we give helpful tips for plumbing and heating, helpful tips for electrical stuff, and sort of what's going on with us. And so we had, in that given year, we had people that had babies, so we were making baby announcements, things like that. And I said, by the way, get your PSA check. It's a simple blood test. You're not getting poked or prodded more than once. You get the blood test, you find out what your PSA score is, and if you're 0 to 4, you're typically in good shape. If you're like I was a 27, you need to seek further treatment. And so I did. And the staff at Mercy in Cedar Rapids at the Hall Perrine Cancer Center did a great job. All of my treatment was done there. And the only way I found out about it, and the only way I really got diagnosed early, was by accident. I changed providers. My doctor retired, and I got a new provider. New provider ran a panel of blood work. Blood work led to finding out that I had a high PSA. And that was at 49. Really, at that time, the recommended age was 50. So I'd have waited an entire year before I would have been likely tested. So I found out early, and that probably helped save my life. I did, after my diagnosis, get some genetic testing, and that genetic testing led to find out that I had a very high percentage likelihood of developing prostate cancer. I'm also at risk for some other cancers, but I had a genetic mutation that led to it. Now, what caused that? It could have been environmental, but I don't have any indication telling me one way or the other, and there's no real way to know.
Mm-hmm. When you first got that diagnosis, I mean, I think for a lot of people who have a cancer diagnosis, it's very jarring, and they kind of want to know that why. Did you experience that? Was that part of the genetic testing?
It was part of the genetic testing. I really wanted to learn what the causes were. Certainly lifestyle plays into it. Diet, exercise, all of those things can have a factor in it. So I don't know what those were, or any combination of those things. And I was adopted, so I didn't really have any genetic background on myself as far as family history. So I wanted to pursue the genetic testing to find out just where I was headed. So it was definitely a gut check, an emotional time both for me and for my family, because when you're given that diagnosis, I mean, they're pretty blunt. And the doctor that I dealt with told me, hey, this is probably going to kill you. if you want to beat it, you need to take aggressive steps. And so we did. And that was surgery first, then the radiation treatments, and did some hormone therapy and things like that. And so all of those treatments played into the success. But I think a lot of it also has to go back to changing my lifestyle a little bit too, and as far as diet, exercise.
Can you say more about that? I mean, what you've learned about cancer since your diagnosis and then joining the board, and how that knowledge has contributed to changes you've made since?
Sure. So I would say, my biggest gain in information has all been from joining the board, the Community Advisory Board, the Holden Community Advisory Board, also networks with, it's a board of people from throughout the state, a lot of public health professionals, but also they want to try and get folks like me to, because I'm a cancer survivor, but also because I have a different perspective, right? And I know that when I speak to understanding, I'm just one little piece of it. I don't know enough to know what's really going on, right? But since joining the board, now I've also gotten involved in the Iowa Cancer Consortium, and the data that is being collected, and it's my understanding that it's been collected since 1973, the year I was born. So since that data started being collected, we've really gathered a lot of information as a state from that Iowa Cancer Registry. And now with the Iowa Cancer Consortium, we're getting more information faster. There's a lot more communication happening with those groups. So are we there? No. I mean, we definitely have more to do, but I think it's improving daily, and certainly through research. And that was a big piece of my focus too, is understanding how the research works. So I've gotten to tour some of the research facilities at the U of I. Just amazing folks. I mean, a different level than I can really relate to in my industry, but it's definitely a learning experience.
Mm-hmm. So, as you know, we've had more conversations about cancer in Iowa recently. How have you felt about the way those conversations are being had?
It definitely needs to be front and center. We're gaining as a population. Our state is gaining to the #1 spot in the country. Kentucky is first, we're second as far as cancer occurrence rates. So if we don't do something to change that, we can pass them. So we need to move beyond that and figure out, what is the cause? Is it lifestyle? It certainly could be.
You talked a little bit about advocacy narratives too in our pre-interview, saying that often advocacy does have a very specific, point, a very specific narrative. How have you seen that playing out in kind of cancer discussions that we're having right now?
I'm still learning the advocacy role. I'm not necessarily an expert in it, but what I've seen play out so far is everybody knows someone who's been touched by cancer. And at the same time, there's a little bit of ambiguity as far as, because it's so diverse and the disease can affect so many different people in so many different ways, it doesn't care if you're a kid or you're an old person, it's everybody. And that concern and that level of impact, and the fact that it's increasing, not decreasing, says that we need to be advocating for more. And certainly that's my goal, is to try to advocate for, better funding for research, and also getting awareness out there is probably my biggest goal for men's health. Just, if you're 45 and older, get tested. If you're a guy, get tested. It's not painful, but we as Iowans, I don't know, it's everybody goes through this. I don't want to get tested because I don't want to find out if I have it. And at the same time, not finding out doesn't prolong your life. So if you can put yourself in a position where you're early detecting, your treatment can be so much easier and better than if you wait until it's much more dangerous to your health. So from that standpoint, that would, if there were a message I could tell anyone, is get those tests. Get, for colon cancer, get your colon cancer screenings, colonoscopies. Prostate cancer, get your PSA test. Breast cancer, mammograms. I mean, there are so many ways that we can prevent the loss of life if we just treat and monitor, but a lot of people aren't doing that. The more people that become aware that the earlier you get tested, the more likely you are to beat whatever it is you're going against, that's key. And having gone through it, that's absolutely, what I would advocate for is communication, understanding. The 99 Counties Project is bringing a focus to public health and bringing it to the public about where we are cancer-wise as a state, and also bringing that into focus to make sure that we're advocating for people to get tested. So we're reaching out to people that aren't being reached by our public health professionals. So that may be, seniors groups, that may be public groups, that may be private advocacy, social. Certainly, all of those things play a factor, and that's what I'm helping try to do. Yep.
Is there anything else that we should have asked you about that we didn't ask? People should?
No, I would say the biggest wealth of information that I've discovered in post-cancer is, as I want to try to advocate for, obviously early testing, better research, better funding for research, I would say that piece of it is all connected to the people and our fear of cancer. And if we can get past a little bit of that and start to just figure out, what we need to do to get tested, to monitor our health, especially as a 49-year-old guy thinking, man, I'm gonna get this. This is gonna kill me. And I figured out very quickly it wouldn't. And some of it was attitude, some of it was probably divine intervention. But at the same time, now I'm able to be here to do what I'm doing. So I wouldn't go out of my way to do it if I didn't believe that it was for a good cause. So if I can help one person not go through what I went through, if they just monitor, it's worth every minute of my time.
You mentioned the fear of cancer is so overwhelming. What was that like when the doctor first told you?
It was a shock. It was a pretty emotional time. There are still times where it kind of gets you, where I was doing an interview for one of the companies, one of my vendors, and it was a little video segment on some community service that my company had done, and I kind of got choked up when we were talking about it. It's like, wow, yeah, I got diagnosed on this day, planned surgery on this day. Everything happened really fast, but it was sort of it was definitely a punch in the gut, finding out that, hey, this is it. This could kill me. You don't plan for that in your 20s, 30s, and 40s. And then all of a sudden it's here, and it's like, you gotta be aware. And really, where it really becomes an emotional thing is when you think about your kids and your wife. And just right now I'm getting emotional thinking about it. And those emotional situations where you go, wow, this is a complete different reality than what I was prepared for. I wasn't prepared for it. I didn't have any idea it was coming. Had blood work, you get a phone call from the doctor, it's like, oh, this might not be good. And then you go in and sit down, and they're like, yeah, you've got cancer. And it was that quick. So that certainly carried a lot of weight for me. And I didn't want anybody to have to go through what I went through. And I had a good friend whose dad died right around the same time I got diagnosed. And same deal. He was 55, never had his PSA checked. I think he was 55. Anyway, he was in his 50s, never had his PSA checked, got his PSA score, and it was 25,000 or something. He was very obviously full of cancer, and there was nothing, there's no treatment. So at that point, it was too far down the road. He couldn't do anything about it. So I've lost some good friends. My dad passed away from liver cancer in 2020. So things I learned were, it's much easier to deal with it if you know what's coming. It's much more difficult, both medically, emotionally, if you don't know it's coming and you've got to deal with it suddenly. So getting tested is certainly the key message there.
How do you think about that now? I mean, are you, because there's always, I hate to say it, but like, there's always possibilities that cancer will come back. How do you handle that fear now?
Well, each day it gets a little better. Each period that goes by in my testing that I clear, another hurdle, it gets a little easier. But yeah, I mean, once you've had it, you're more likely to get it again. Certainly, there's any point in time I could be in there. So the big key is having those regular checks. I had a regular blood work review this morning. I have those. I believe I do them quarterly now, but I'm also working toward total health. I've got a healthcare provider that's engaged. We're talking about, my exercise plan, my diet, any medications that I'm on, and trying to maintain all of those pieces and managing stress to make sure that I'm not putting myself in a position where I'm at a higher rate of risk.
Yeah, so a lot of Iowans are at higher rates of risk for a lot of reasons. What would you say to Iowans who want to minimize their cancer risk?
Talk to your healthcare professional. Your care provider can help you more than the internet. You can get more information, and they are happy to give it to you to help you prolong your life. So if you can put yourself in a position where they say, hey, man, your stress level is too much, or you're overweight, or you're a tobacco user, or you drink too much. All of those things are factors that can contribute to things like cancer, heart disease, whatever, but that's where, focusing on that a little bit. I never really focused on my health until I was pretty much 50. Up until that point, yeah, I went through, I don't want to say fads, but I dieted, I exercised, but I never really focused on totally managing my health and never really cared. I thought I was tough enough that it didn't matter. And that would be one piece, is we're all tough enough until we're not. So we probably should be talking to those healthcare professionals and making sure that we've got that stuff managed.